Welcome to week 15 of your 40-week pregnancy journey. It's the second week of your second trimester. At 15 weeks pregnant, your baby is growing and maturing, and you're likely to have more and more energy and a lot less of nausea. Your baby's development at week 15. At 15 weeks, a baby is almost 4.5 inches in length, that is 11.5 centimeters, and weighs about 4 ounces, that is 114 grams. The baby continues to grow and mature this week. By 15 weeks, the baby can make whole body movements, move their arms and legs, stretch, and make breathing motions. The outer part of the baby's ears are growing and steadily becoming more recognizable. Meanwhile, the inner ear continues to develop. Your baby's skin is still very thin and translucent, allowing a clear view of the blood vessels and skeleton. Bones continue to ossify and harden. Some bones in the skull, spine, and shoulders, along with the collarbone and the long bones, have already begun to process. Your common symptoms this week. As some of the first trimester symptoms subside, others may start or continue into the second trimester. You may experience headaches, heartburns, dizziness, and skin changes. Number 1. Weight. You may start to feel noticeable weight changes this week. Women typically put on about 1 to 5 pounds during the first trimester and about 1 pound each week after that. If your weight has changed significantly or more significantly less, it's worth talking to your healthcare provider about it. Number 2. Bleeding gums. Pregnancy hormones affect the dental health, and pregnancy can cause gingivitis or sore, red, and swollen gums. Starting in the first trimester and getting worse in the second and the third, it then gets better after the baby is born. Number 3. Nosebleeds. Between hormones and more blood circulating in your body, there is more blood flowing through your blood vessels, including the blood vessels in your nose. Occasionally, those blood vessels break and bleed. It typically goes away after the baby is born. So, here are some self-care tips during this week. Take some time this week to learn about healthy weight gain and dental health during pregnancy. It's almost good time to review what to do if you get a nosebleed. Number 1. Healthy weight gain. To increase the odds of the safe, healthy pregnancy and delivery, you should try to stay within the recommended guidelines for weight gain in the pregnancy. The American College of Obstetricians and Gynecologists recommend the following weight gain targets: underweight, that is 28 to 40 pounds, normal weight, that is 25 to 35 pounds, overweight, 15 to 25 pounds, obese, 11 to 20 pounds. Excessive pregnancy weight gain is also associated with pregnancy complications including high blood pressure and gestational diabetes. It's much easier to keep an eye on your weight gain if you start early. Number 2. Caring for your dental health. Dental health is important throughout your life, but especially during the pregnancy. It can then progress to a more dangerous condition called periodontitis, which is linked to premature birth and low birth weight. To keep up with your oral health in pregnancy, brush your teeth at least twice a day, brush for 2 minutes each time, see your dentist regularly for cleaning and checkups. Number 3. Dealing with nosebleeds. Nosebleeds can be scary and annoying, but they are rarely dangerous. You can treat an occasional nosebleed at home by sit down and keep your head up. Don't tilt your head back or put your head forward between your knees. Place an ice pack on the nose to help stop the bleeding by constricting the blood vessels or making them smaller. When you have to blow your nose, do it gently. So, in the nutshell, here is your week 15 checklist. Eat healthy, balanced meals to get the nutrients you need. Get regular exercise. Begin tracking your weight to be sure you gain enough but not too much. Write down the questions for your doctor so you don't forget them when you go to your next prenatal appointment. Make an appointment to see your dentist if you haven't yet. Thank you. Please like, subscribe, and share our YouTube channel, The Voice of Woman, and press the bell icon to stay tuned for the latest updates.